There have been more than 3,200 possible opioid overdoses in Arizona and 426 deaths just since June. That's when Governor Doug Ducey declared a public health emergency in the state and when Washington may follow suit. Cronkite News reporter Fraser Allan has more from the Capitol.
President Donald Trump said in August that the administration is working on a plan to deal with the opioid crisis.
We're going to draw it up and we're going to make it a national emergency. It is a serious problem, the likes of which we have never had.
Trump said yesterday that the plan could come next week when he plans to declare the opioid epidemic a public health emergency. Whatever form the plan takes, experts said yesterday that solutions will have to involve a change in how the justice system views addicts. It was in the early evening here at the National Academy of Sciences that the Surgeon General of the United States sat down with policymakers and other health advisors to discuss possible solutions to the growing and pressing problem of the opioid epidemic. The panel discussed the need for changes that extend beyond the scope of the health department. In conversation with Stephen Leifman, former special advisor on mental health for the Supreme Court, Surgeon General Jerome Adams told a personal story about the crisis.
I've dealt with addiction. I have a brother who's in prison right now because he has untreated mental health problems, which turned into untreated substance use disorder, which turned into a prison sentence.
In fact, people with mental illnesses and co-occurring disorders are 9 times more likely to be incarcerated than hospitalized.
Trump's plans could be derailed by today's announcement that Pennsylvania Congressman Tom Marino has taken himself out of the running to be the White House's drug czar. Marino's decision follows a Washington Post 60 Minutes report that he was the driving force behind legislation that made it harder for the Drug Enforcement Administration to crack down on the easy supply of opioids.
He was very gracious, I have to say that. He didn't want to have even the perception of a conflict of interest with drug companies or, frankly, insurance companies.
Whenever the changes come, the Surgeon General says the key challenge will be meshing health and criminal justice into a complete solution.
I think we've got to bring the law enforcement community, the business community, and the public health community together because, quite frankly, we've all been living in our silos.
In Washington, Fraser Allan, Cronkite News.
While the president said he would unveil his plan next week, no date has been set, and the White House has not released any details on what that plan might include.